Good afternoon. My name is Randy Wolken. I'm President and CEO of MACNY and the Manufacturers Alliance. This is my COVID-19 update for Tuesday, April 21st. The curve continues to flatten and the numbers are down for the 8th straight day. The amount of net hospitalizations and number of intubations continues to decrease, but there still are a significant and meaningful number of COVID hospitalizations every day. There were 1,300 yesterday. There were a total of 481 COVID-related deaths yesterday. Of this, 452 were hospital deaths and 29 in nursing homes. This represents a slight decrease from the previous day and for the last several days has been flat. A total of 14,828 New Yorkers have passed away due to COVID-19. The governor today announced a regional approach to reopening the economy. This will be done based on each region's COVID-19 facts and circumstances. Different regions of the state have different curves and variations, and while they're indicating in Albany and other places that we are one state, we need to take into account and understand these variations in order to get our economy open as soon as possible. Factors that will be taken into consideration include hospitalization rates, hospital capacity, infection rate, and if the region is on the ascent, descent, or a plateau. Lieutenant Governor Kathy Hochul will be in charge of the Western New York Regional Public Health and Reopening Strategy. Former Lieutenant Governor Bob Duffy will coordinate the Finger Lakes region. And there will not be regional committees formed, but it will be coordinated between the state and local officials, and the decision will be data-driven. Any plan to reopen the economy and society, both regionally and statewide, will revolve around testing, because testing is the best way to track the infection rate. New York is testing more than any other state in the United States, but more testing will need to be done. Testing will be the focus during Cuomo's meeting with President Trump today. The governor stated there needs to be better coordination between the federal government and the states on testing. The federal government should provide the national private manufacturers with what they need, and then manufacturers can feed the state laboratories and states can manage the testing from there. After testing, we will need an army of contact tracers and isolation policies to keep the control of the rate of infection in check. We'll need to be aware of hotspots and increased need within regions of the state that have not really been hit yet. When downstate needed help, upstate pitched in. New York is ready to surge capacity and to help regions when needed. Elective outpatient treatments will be allowed for hospitals and counties without significant risk of a COVID-19 resurgence in the near term. Westchester, Southern Rockland, Erie, Albany, and Dutchess, and several other counties, which were not named during the briefing, will be excluded for now. On unemployment, the state has 1,000 people handling incoming unemployment calls and still can't keep up with the volume. This is a much larger capacity challenge than faced before. Once you qualify, it will be retroactive, and you'll still get the same benefit even if you have not been able to get through yet. The governor reiterated it's a terrible mistake not to provide funding for states in a stimulus package, and one of the reasons he's going to Washington. The governor has issued Executive Order 202.22. It relates to real estate property transactions. If you're interested, you should read it. There are several important elements to it. It's on our website. New York City Executive Order 108, also may be relevant to you, related to things such as the duration of the emergency, related to things around sidewalk cafes, and additional other changes or necessary requirements in New York City. There are several updates to guidance available on our website related to New York State Education Department, the New York State Division of Homeland Security and Emergency Services, New York State Workers' Comp Board, the Office of Mental Health, the State Department of State, And there have been no changes to Empire State Development's identification of essential businesses. And there are several changes in terms of New York City agency suspensions and reductions. You can get all this information on our website. We have updated our website so that the most recent information will be available to you once you go to our website, which is macne.org. Mercer Norcross and our communication team, along with our partners, have done a wonderful upgrade to the website to help you deal with all the current updates as well as to find past updates that you may be interested in. You will see on our website the availability of all of our digital offerings, which all of our offerings now are online. As I've mentioned in past updates, MACN's entire team is working from home safely and working hard to support our members, to help manufacturing stay safe and our members stay safe. And we're working diligently with public officials and regional representatives to help manufacturing and all sectors of our economy to get back up and running. This is going to take some time and effort. We won't be open anytime soon, immediately. That's just not in the cards as outlined today by the governor, and we're seeing happening across the country. This will have to be a gradual reopening process. It's going to need to be driven by the healthcare data and the ability of the healthcare system to handle potential infection rates and potential hospitalizations that could come from our attempt to reopen our economy. It's clear to all of us we do need to open our economy again. The unemployment rate has soared. Potential of lost businesses has increased, and a lot of pain is being felt even as we speak. You have my commitment. We'll be working hard on this. We think that this also will spark a renewed interest in New York and U.S. manufacturing. We need to make things in this country. That includes consumer products, not just those critical products having to do with healthcare and defense. It's time that we relook at where things get made, and we get them made in the U.S. again, where they should have been made from the start. We're here to help you. You can get a hold of any of my teammates, the MACNE staff, through our website. Our phones are twinned. You can call. We'll get back to you as soon as we can. We're interested in helping you be successful during this difficult time. And as always, be calm, stay safe, and carry on. Have a nice evening.